everybody. I am Emma. I am in a group with Lexi and David. Today I'm going to be talking to you about eclampsia and preeclampsia. So what is eclampsia and preeclampsia? So preeclampsia is the start of what a condition is. It's a pregnancy complication that is characterized mainly by high blood pressure and can damage other organs such as liver and kidney. Serious condition that can be fatal for both your loved one and her baby. This often begins around the 20-week gestation period, but it can also turn into postpartum eclampsia, which can be dangerous as well. Preeclampsia can turn into eclampsia if it's not treated. This is fairly rare, but it is a serious condition that can cause seizures, coma, other serious effects. This is characterized again by protein in the urine caused by poor liver and kidney function. So symptoms, how does this happen? Pathophysiology, how does this happen? So it's basically poorly understood. However, there are some factors that researchers have figured out. So poorly developed uterine placental spiral arterioles. So you can see them here. In a normal pregnancy, this is what they look like. So the spiral artery is connected to the placenta, which gives the baby oxygen and nutrients. However, in preeclampsia, you can see that there is a little twist there. There's an obstruction in the blood flow, which can cause lack of oxygen, lack of nutrition, and poorly developed placenta. So then another factor may be an abnormality on chromosome 13. So chromosome 13 is prone to abnormal placental wall. So the placental wall is vital in maintaining healthy placenta once again, and in turn a healthy fetus for your loved one. This placenta provides oxygen and nutrients to your relative's growing baby. So generally the placenta attaches to the wall of the uterus at the top, sides, front, or back. With an abnormal wall, this lack of oxygen and nutrients are delivered to your relative's baby, causing complications such as preeclampsia. Immunologic abnormalities. So this is basically when you have a suppressant immune system. So it's an immune tolerance, which is a lack of response from your immune system, which then causes inflammation and once again lack of blood flow to the placenta. So then another factor is ischemia or infarction of the placenta. So ischemia is a basic inadequate supply of blood flow, and an infarction is a complete obstruction of blood flow. And then lipid peroxidation of cell membranes induced by free radicals. So basically what happens is the lipid cell is getting their electrons stolen by free radicals that are uncharged ions. So this can cause cell damage and death, which can lead to poorly developed placenta once again. So symptoms of this. So preeclampsia, there may be no symptoms, but basically the biggest symptom is high blood pressure, which is 140/90. Protein in urine, which can be by fizzing or bubbling urine. Swelling in the legs and water retention, which once again can be a normal pregnancy symptom, but it can also be a sign of poorly functioning kidneys and liver. Fatigue, blurred vision, and also spots in your vision. A new onset of a severe headache, nausea, weight gain, and upper abdominal pain. So some of these symptoms are pretty common in normal pregnancy, but when paired with high blood pressure or protein in the urine, it's a obvious symptom of preeclampsia. Postpartum eclampsia can start up to 6 weeks after delivery, which is once again the symptoms of preeclampsia. And eclampsia, there may be no symptoms prior to onset, but often preeclampsia follows before eclampsia starts. So what is different of eclampsia is that there are seizures, loss of consciousness, agitation, organ damage, and a coma. So diagnosis. To diagnose, you must have high blood pressure of 140/90 and one of the other following. A low platelet count, which will do a blood test. Impaired liver function. Fluid in the lungs, fetal ultrasound. and new onset of blurred vision. So they will do a test, they will do a urine test that's going to count the amount of albumin in the urine, and they can do a blood test to get those platelet counts. They're going to do a fetal ultrasound, and they're also going to do a non-stress test, which is when they hook up a heart monitor to your baby, and they just monitor the fetal heart rhythm during just their normal movement. So non-stress means that there's no stress placed on the baby, and it's just a quick test to figure out how the baby is functioning. So treatment. The most effective treatment is delivery of your loved one's baby. However, if it is too early to deliver, which is around 24 weeks, is when the fetus is viable, they will be given medications such as antihypertensive to lower blood pressure, corticosteroids to lower inflammation, and anticonvulsant medications if they're having seizures. Another important factor is bed rest to get that blood pressure under control, and hospitalization for monitoring. So follow-up and prognosis. Most women with mild preeclampsia have a good outlook. Eclampsia, however, has a 2% mortality rate because it can be very dangerous to both the mother and the baby. Reoccurrence rate for those with severe preeclampsia, which is what starts in the early stages of pregnancy, are 25 to 65% in recurring pregnancies. However, with mild preeclampsia, the recurrent rate is only 5 to 7%. Follow-up medications to lower blood pressure, such as antihypertensives, and making sure that postpartum preeclampsia does not happen. So you're going to be watching your blood pressures closer. You're going to be taking medications to prevent any seizures, and you're going to really need support from your loved ones, from her loved ones. So she's going to need a lot of emotional support, as this is a very scary time for both her and her baby. Okay, so these are some of the sources that I used. If you're looking for more information, I used the Mayo Clinic and Healthline for both of these if you need any more information. Thank you.